Have you ever really stopped to think about the sheer mechanics of walking? I mean, it seems so simple, right? But underneath the surface, there's this incredible, constant battle being fought by a set of unsung muscular heroes just to keep you from falling over. Today, we're going to pull back the curtain on your hip stabilizers and find out how they keep you upright with every single step you take. Seriously, think about it for a second. Every time you walk, you're essentially balancing on one leg. It's just a continuous, controlled fall. So what magic force is at play that stops your body from just collapsing sideways every time you lift a foot? It's this fascinating biomechanical puzzle that we solve thousands of times a day without even noticing. Well, the secret lies in this constant, invisible fight against something called pelvic drop. The second you lift one foot off the ground, gravity is right there, trying to pull the unsupported side of your pelvis down towards the floor. And preventing that drop? That's the whole key to a smooth, stable walk. Okay, so to understand how we win this fight against gravity, we first have to look at the core machinery we're working with, the actual architecture of the hip itself. You know your hip bone isn't actually one single bone. It's really a fusion of three different ones that all come together. You've got the ilium, that big fan-shaped part at the top, the ischium, which is basically your sitting bone, and the pubis, right at the front. They all meet up right at the hip socket. Now for our story, the bone we really need to focus on is the ilium. This broad, kind of wing-like bone is the crucial piece of the puzzle. It provides this massive surface area, which is the perfect anchor point for the muscles we're about to meet, the real heroes of our story. And here they are. It is time to meet the powerful muscles that attach to that ilium and work tirelessly to keep you upright. Let's meet the sideways stabilizers. So, the main hero of this whole operation is the gluteus medius. It's this beautiful fan-shaped muscle you see right here on the side of your hip. And as you can see, it is perfectly positioned for the job it has to do. What's so crucial here is how it's positioned. It starts, or originates, up on that broad outer surface of the ilium, and then it connects down to the very top of your thigh bone. Now, its main job is something called abduction. That's moving your leg out to the side. But its secret superpower, the one that keeps you from toppling over, is preventing that pelvic drop. And you know, every hero needs a sidekick. Lying just underneath the gluteus medius is the gluteus minimus. It's smaller, sure, but it works in perfect harmony with its bigger partner, also helping with that abduction and that all-important pelvic stabilization. Okay, this is where it gets really, really cool. This whole system doesn't just work through brute strength. It actually works like an elegant, simple machine, a class 1 lever to be exact. Let's dig into how it all works. Let's break this down. On your standing leg, the hip joint itself acts as the fulcrum, the pivot point. The lever arm is your whole pelvis, specifically that ilium bone. The force is applied by our heroes, the gluteus medius and minimus, pulling on that ilium. And what are they fighting against? The resistance, which is just gravity and the weight of your body trying to pull the other side down. So when you're standing on your right leg, it's actually the gluteus medius and minimus on that same right side that contract. They act like these powerful cables, pulling the right side of your ilium down, which in turn levers the left side of your pelvis up, keeping the whole thing perfectly level. It is just an incredible feat of engineering. To really appreciate this stabilizer role, it actually helps to compare it to a muscle with a completely different job. So on the left, we've got our stabilizer, the gluteus medius, and on the right, a primary mover, the iliacus. Both of these muscles attach to the ilium, but for very different reasons. And this just illustrates the difference perfectly. The gluteus medius pulls sideways. Its entire goal is to prevent you from falling. The iliacus, on the other hand, is a powerful hip flexor. It pulls forward to swing your thigh up and power your movement. See, one is for stability, the other is for mobility. Both are absolutely essential, but their roles couldn't be more different. So, we've met the heroes, and we've seen how the machine works. But what happens when that machine breaks down? What happens when our heroes just aren't strong enough for the job? And this is a really important question. Because if the force-generating part of our lever system, those glute muscles, is weak, the entire system can fail. And that failure has a name. It's called the Trendelenburg sign. This is exactly what we were talking about at the very beginning. When you stand on one leg, if those abductor muscles on the standing side are weak, they just can't counteract gravity. So the opposite side of the pelvis drops down, creating an unstable, inefficient walk. It's a direct, visible sign that our heroes are struggling. So after all this biomechanics, what's the big takeaway here? How does understanding this intricate little system of bones and muscles actually help us? Well, the main thing to remember is this. A stable pelvis is the foundation for pretty much everything. It's not just about walking smoothly. When your hip stabilizers are strong, it creates a solid base that can help protect your knees and your lower back from all kinds of compensatory strain. It's a great reminder that the muscles moving you sideways are every bit as important as the ones moving you forward. So the next time you take a step, just think about those unsung heroes working away on the side of your hip, fighting gravity with every single move you make. Your hips are your foundation. The only question is, are you giving your stabilizers the attention they really deserve?